And joining us now is Onondaga County Health Commissioner Dr. Katie Anderson. Dr. Anderson, thanks for being here.
Good to see you.
Well, let's get started off with water quality and water safety. We just shared the story of Janesville Beach being closed again, not because of algal blooms, but this time because of E. coli. What's happening?
Right, so Janesville Beach is closed down right now because the routine testing, which is done every 2 to 3 weeks, depending on the beach in our county, showed that the levels of this bacteria are beyond what is considered safe. So the beach is now again closed down, as you mentioned previously, for algal blooms, now for elevated E. coli. They'll be testing every day, and when it gets down below that level, it'll be reopened again. But this is a sign that this is a common issue, our water quality, especially with these hot temperatures, and it's something we monitor very closely.
So I'm guessing we'll likely see algal blooms somewhere in one of our bodies of water. What is the real danger there when people spot them, and why we keep away from them, and our pets too?
Right. So with algal blooms, we are at that time of year when it's not an if, it's a when. The water temperatures are getting hotter. And to be clear, there's different kinds of algae. This is a specific type of algae that often has a distinctive appearance. It's kind of blue-gray or blue-green colored. If you put a stick in it, which we don't recommend people do, and pulled it out, it would look like it was dipped in paint, which is different than some of that other algae we may see. We worry about it because if you breathe it in, if you swallow it, or you get it on your skin, it can be dangerous for your health. And it's particularly dangerous for pets who may drink the water, may play in it, and be even more exposed. So if you see an algal bloom, don't go near it. If you get it on your skin, rinse it off.
All right, let's talk about mosquito viruses. They continue to be an issue for us. Triple E and West Nile virus. We had the first human case of West Nile. And now another virus to worry about. This one's called the Jamestown Canyon virus. Could you tell us what that is, how it was found, and how concerned should we be?
Sure. So routinely, the health department will collect mosquito pools. We've so far this year collected over 300 mosquito pools and tested over 100,000 mosquitoes. And we look for a variety of different viruses. The one we worry about most is Triple E, because if infected, it's about a 30% fatality rate. It can be very serious. There's other viruses like Jamestown Canyon, which are not as severe. They can cause some human disease. We found it in our mosquito pools this summer as well, in addition to West Nile, in addition to a few other viruses. It's Triple E we, in particular, really worry about.
Can you get any kind of gauge on what type of summer we're going to be having with those, or are we just at a point where, like you said, kind of with the algal blooms, it's not an if, it's a when, and we just always need to be cautious with being outside, especially dawn, dusk, those kinds of things?
That's an important question. So I think we are definitely into the fight the bite season, where the mosquito populations are high, we're finding infections in them. So people need to be wearing their DEET or picaridin, wearing long sleeves, emptying standing water. But we are also trying to get the message out that just because we haven't found it in a certain place at a certain time, we seem to have Triple E every summer here, especially around the swamp. And so people should take precautions regardless of what the testing is showing.
And is that triggering consideration for aerial spraying? Will that be another round of it this summer?
Likely, and we're discussing that right now. So there's not a specific threshold. When we cross it, we know, but we take multiple things into consideration. How high are the mosquito populations? Are they peaked and starting to come down? Because that's often a good time to spray, particularly if there have been multiple pools over multiple weeks that are positive. So at this point, we're likely looking at early next week, at which point we would certainly send out a press release and make an announcement in advance of that, as well as reverse 911 for people who live close by.
Okay. Slightly changing gears a little bit, and this is more, I think, of a mental health kind of question for you. We've talked a lot. Everybody kind of knows about it. The cell phone ban will be coming to schools starting in September. We're almost to August. What kinds of things should parents be doing now to help starting to wean those kids who are all day on those cell phones?
Addicted to it,
yeah,
really.
Basically, yeah.
Right,
what should they do now?
The rationale for New York putting that policy into place was that the evidence is showing that kids who are on their phones all the time have less attention at school, they're able to focus less, they have less interpersonal interactions, and it can impact their mental health. So I think this is a good change, but it's a big one. So going into the fall, parents can start to do things like implementing phone-free times and activities, no phones at meals, specific activities when you're interacting face-to-face and the phone isn't allowed, to make that transition a little bit easier.
And I suppose parents can also set the example too. When they say no phones at dinner, that means parents too,
also
right?
put your phone down and practice attentiveness.
Yeah. So it's good to start now, I would think.
Yeah, I would think so too.
Kids are watching us all the time. Okay, last one, also kind of school related here. As I mentioned, we're almost a month away from school. What should parents know, especially maybe parents of kindergartners or things like that, as far as things they should have in place, like vaccines, to make sure they're ready on day one. Don't wait till the last second.
Yeah, that's an important question now for two reasons. We are just under a month away from school starting, and there are specific vaccines that kids, specifically different ages, will need to get in order to stay in school. New York is particularly strict in that way. There are not religious exclusions. Kids have to have their vaccines or they may be excluded. If you wait until the end of August, those appointments may be gone, the primary care doctors may not be available, and you may be scrambling. So this is the right time to be thinking about those back to school sports exams, physicals, and especially those vaccines they need to be in school. The other reason this is so important right now is that we're in the middle of the largest measles outbreak, for example, that we've seen in the United States for many years. The other vaccine preventable diseases, which can be serious, are still out there. So that's another reason why right now it's really important, now more than ever, to have your kid up to date on their vaccines.
All right, parents, you got the order. Get to it. Thank you, Dr. Anderson. So much great information you're sharing with us tonight and for our viewers.
Yep, thanks, Katie.
Thank you.